For many women, pregnancy is at the top of the list when they miss their periods. And that's an easy thing to think about when you're sexually active. But then, did you know that there are many other reasons why you could miss your periods apart from pregnancy? And especially when you're not sexually active, or even if you are and you're sure that you're not pregnant, you begin to think, what's happening? Am I pregnant? Am I not pregnant? Well, in this video, I'm going to be talking about 10 reasons why you could miss your period. So let's get into it. Hello and welcome to Case Corner. My name is Karen and I am so glad that you're here, and thank you for taking some time to watch this video. Today I will be talking about 10 reasons why you could miss your periods, and obviously you know what the first one is. So let's just get straight into the video. The very first reason why you could miss your period is due to pregnancy. Obviously, pregnancy comes because the egg has been fertilized by a sperm cell, and obviously you will not have your periods when you are pregnant. But one thing you need to remember is the fact that if you do a pregnancy test too early, the test may come back negative even if you are pregnant. That's because the test is not yet able to detect the hormone in the urine, especially if you use a urine sample. So just so you know, don't do the test too early because it might come out negative even though you're pregnant. The second reason why you could miss your period is actually a late ovulation. Sometimes ovulation happens late. There's several things that happen in the system, and ovulation doesn't happen at the time when you expected it. So that definitely means that your periods will also be late. Well, in that case, the period is just late. It's not completely missed because you would actually have your periods, but they'll happen a little bit later than you think. So yeah, your periods could be missed because the ovulation was late. The third reason is stress. Stress is a massive thing. I think we all know the whole issues about stress and what stress could do to the human body. But one of the things is the fact that you could miss your period just down to stress. And obviously what stress does here is that it affects the part of the brain that is responsible for stimulating hormones to be produced. And if that happens, then that means that you cannot ovulate, and then that means that you don't have menstrual periods. Usually when you go through the stress period, then things come back to normal and you're able to have your periods. But during that time, when you are really undergoing some heavy levels of stress, you could miss your period. Or for some women, they don't really miss their periods, but it just becomes irregular. For some women, they start having painful menstruation when they normally did not have pain when they menstruate. So stress is a really big thing when it comes to menses or periods for women. You want to be sure that you are taking care of yourself during those difficult periods. You just want to be sure that you're putting in some things to manage the stress, because one of the things which stress could do is the fact that you could miss your periods. The fourth reason is the fact that some women have irregular periods. Now, irregular periods are normal for teenagers or for the girls who are just starting their periods. It takes a while for the body to get used to, producing the hormones, and then having ovulation, and then getting periods on a regular basis. So when they just start having menstrual periods, it's normal for them to have irregular periods, and sometimes they would miss the periods because of the irregularity. And also during the perimenopausal stage, so at the time when you're transitioning from having periods to getting into menopause, some women will also come down with irregular periods, and part of the irregularity here is the fact that they will miss their periods. Outside that, you also have women who just have irregular periods and they will miss their periods in some months. It is important that you seek medical help when your periods are irregular, especially when you discover that this irregularity is becoming kind of the normal thing. So you have your last period in March, and the next one comes in May, then comes again in April, then the next one is somewhere in July, and you just don't have control, or you're not able to say there is a clear pattern of how you have your periods. That is irregular periods, and because you're having irregular periods, you could miss some months or some cycles. So it's important that you seek some medical help for that. And that just leads me very nicely to the next reason why you could miss your periods is if you are in the perimenopausal stage. So that's a transition between your reproductive years where you're having your periods and the childbearing years, and into this period where you don't have periods, so you're getting into menopause. So during that transition, you could have irregular periods, and again, like I said, you could miss some periods. However, you need to understand that you retain the ability, the possibility to become pregnant. And that's why it's important to be sure that you're monitoring your periods during this time until your periods completely stop, when you know that, okay, I am now in my menopausal stage. You just need to know that sometimes you have periods and other times you wouldn't have periods. That's because you're in the perimenopausal stage, you know, just leading up to menopause. So that could be one of the reasons why you missed your period. Acute and chronic diseases could be responsible for the fact that you missed your periods. I'm looking at things like heart diseases, kidney failure, thyroid dysfunction, those kinds of things that, you know, could lead to imbalances in hormone production. They could be responsible for the fact that you don't have periods or that you miss your periods. I'm really just hoping that in the event that something like this happens, you will be in hospital, not at home. So it will be managed properly. I think I'm at the 7th point at the moment. So the 7th reason why you could miss your periods is if you're on certain medications, all right? The one that comes to my mind quite easily is hormonal birth control. So if you're on hormonal birth control, some of them actually would make you miss your periods. All right, so that's one of them. Blood thinners could also make you miss your periods. Generally, when doctors put you on medications, they will tell you all of that, and they'll tell you the side effects, they'll tell you what could happen, so that when you start experiencing these things, you have that comfort in your mind that, okay, it's because I'm on this medication. However, if you're taking any kind of medication and your periods suddenly stop or your periods start getting irregular, please go back to the doctors and let them know. It's important that you explain this to them so that they can have a chat with you and either replace those medications or just talk you through what's going on so that you have some kind of rest in your mind. So the 8th reason why you could miss your periods is if you have any issues with the ovaries. Obviously, that really just goes without saying because the ovaries are a key organ, or the key organ when it comes to periods. All right. We know that the ovaries will release the egg, and then if the egg doesn't get fertilized, that's how you have your periods. So anything that stops the ovaries from releasing the egg will definitely stop you from having periods. I mean, the ovaries could still be functioning and the problem is not from them, but technically, if the ovaries have got an issue, there are chances that you could miss your periods. And just before I go to the 9th reason why you could miss your periods, don't forget to like this video if you're having any benefits from it at all, and don't forget to turn on your notification bell, and why not consider subscribing to the channel so that you don't miss any of these videos when I do upload them. God bless you as you do that. The 9th reason why you could miss your periods is down to all the issues around weight. So whether you are overweight or underweight, or you've lost a large amount of weight too soon, all right, that just leads to the fact that the amount of hormones that are produced will suddenly drop, and then that leads to imbalances in hormone levels. And then that also just leads to the fact that your menstrual periods kind of just gets distorted, and then you could miss your periods. The other way around is the fact that you could have a large production of hormones leading to imbalances in hormonal levels, and then that just means that you could end up missing your periods. For some women, it's not actually that they miss their periods, it's just the fact that they then have irregular periods. But obviously, when you look at the whole cycle around periods that are irregular, it just means that they are missing 1 or 2 periods, on top of the fact that they just are not able to trace a clear pattern of when they have their periods. So each time we're talking about irregular periods, somewhere around irregular periods is a missed period. All right. So just to note here that if you're losing weight too quick or you are overweight, there are chances that you could miss your periods. The 10th reason why you could miss your periods is actually one that is funny. And I call it pseudo amenorrhea. All right, so pseudo meaning false. So it's false loss of periods. Now, that just means that you did not miss your periods. Your periods are due when they are actually due, but the point is you think that you have missed your periods because you haven't taken time to study your period and know exactly when you're expecting your periods. So you start worrying, you start panicking, you start going to the doctors, you're shaky, you're just not at rest because you think that you've missed your periods when you actually haven't missed your period. Your periods are actually due when they are due, but you haven't taken the time to study your period and know when to expect your period. So that's kind of a false missed period because the period is not actually missed. It's really important that you take the time to study your period. Take the time to learn about your period. Actually, in my next video, I'll be talking about how to study your period so that you know what to expect, when to expect it, and when to know when things are not going the way they should go, when to seek medical help as far as your periods are concerned. In the meantime, I will be linking a video just somewhere here or in the description about some things which you should be watching for when you're on your periods. If you notice any of these things, you need to seek medical attention. Thank you for watching. God bless you. I'll see you in the next video.